Ms. Sangeeta Reddy, Joint Managing Director with the Apollo Hospital Group, and Rahul Pandit, Director of Critical Care with Fortis Hospital. And lots to understand and perhaps discuss. Why corona cases have gone higher? What about the vaccine rollout? How come that has not started impacting the virus spread? But the most important news which we would deliberate and debate with our experts is that the government has decided to increase the gap between the first dosage and the second dosage for Covishield, which is the Serum Institute stroke AstraZeneca vaccine. Is this a move which should be endorsed medically, or this is a move which could be a indication or a prelude to the fact that now vaccine will be available for more mass population? Mr. Reddy, Dr. Pandit, good morning to both of you and thank you for joining us. Mr. Reddy, I guess my introduction was the question in itself, which is that scientifically, do you think it makes a lot of sense now to increase the gap between the first dose and the second dose of the AstraZeneca stroke the SIL vaccine?
So clearly there have been studies to show that the efficacy is higher with an increased interval. And therefore it makes scientific sense. It also makes sense considering the fact that it will enable us to give the first dose to many more people. So, I mean, overall, it's a policy that is well endorsed by the scientists and the medical community and is a practical solution towards a wider adoption.
Ms. Reddy, India has emerged as the vaccine capital. We have exported vaccine to 40 countries. But is it a coincidence or perhaps lack of guard from Indians that when the vaccine rollout happened, there has been a surge in corona cases? It should have been the other way around, right?
So clearly, I mean, that is something we could think about, but worldwide, there have been emergence of new variants, there's resurgence, and COVID has now become what we call endemic. It is like any other virus. From a pandemic, it's now part of the disease burden of a country and the world. And therefore, there will be surges, there will be peaks, there will be valleys. The only thing that we can do is mass immunization and universalization of all the protection methodology that we all know. So communication on that, as well as hastening the pace of the vaccination for the entire population, not just the vulnerable, not just the elderly, is really the only way to go. And I think that those are the steps which are being planned right now as we speak.
Okay,
I think also in the interim,
in terms of the kind of...
Go ahead.
Go ahead, Sangeeta. Go ahead. Do finish your point.
I said besides the three, so one is vaccinate as quickly as possible, reinforce all the COVID appropriate behavior that everybody knows and make that strict once again, stop large-scale weddings, and then go back to the contact testing and tracing, which served us very well to control in the early days. You remember how testing ramped up, tracing was very effective, and therefore we were able to contain the spreads. So all those principles and the learnings we've had over the last 1 year should be applied in complete measure now so that we get over this potential crisis as well.
Okay. Rahul, if I could come to you, to try and understand in terms of the attempts to speed up with the vaccination process. We are hearing, of course, more on that. But what about the time between doses and the ensuing debate around that as well? Is there merit to that, or should there be no delay in completing your second dose? How are the authorities really going about this?
So scientifically, as Dr. Sangeeta said, that there is enough data now in the literature. We had a recent publication in the medical journal called as Lancet, which is a very, very reputed and respected journal, where the AstraZeneca, Oxford published their US data, which showed that clearly if you delay the dose between 8 to 12 weeks from the first dose, you had an efficacy in the range of 80% plus. And there was 100% efficacy in preventing a severe form of a disease. And this group of patients had almost 20% individuals who were above the age of 65. So it makes a very, very clear scientific sense to actually delay the dose up to 8 weeks or a little bit more. And the government's move to actually allow it now to happen between 6 and 12 weeks, 6 and 8 weeks is a welcome move. And what it will do is it will also give us more efficacy in terms of having no COVID symptoms, but it will also free up some doses to be given up as a first dose to a larger population. And that will help us into speeding up the immunization process in general. So it's actually a very, very welcome move to go ahead.
Okay. Sangeeta, in terms of the kind of events that we continue to see around the country, with mass attendance, I mean, is there a tone deaf a kind of sort of scenario here where people are misunderstanding the seriousness of the situation and the ability for this to spread again at a faster pace?
Clearly, there are pockets of individuals who are disregarding the seriousness of the situation. It could be a combination of just being tired, word spreading around that, getting COVID is not so bad. So I think it's important for us to re-educate public that it's not just the infection or the mild fever, it's the potential damage that subsequently could also happen, because we are seeing an increased incidence of cardiomyopathy, which is the heart muscle getting damaged, increased instance of lung infections, clots, strokes, all these. So there's a serious need to spread the information that people should be careful about COVID. The second aspect, I think, which is very important, is that possibly we must begin to understand the fact that the younger age group, 18 and above, are the ones with the highest activity, and therefore are the ones possibly who are spreading this. So we need to not just educate, but also ramp up the pace of the mass immunization.
Rahul, wanted to understand from you what you think can be done in order to just speed up the vaccination process, because as things stand right now, it's the age of 45 plus with comorbidities as well as 65 or 60 plus rather. In order to make sure that we speed up this vaccination process, how do you think we should go about it next? What should be the next age bracket in order to sort of ensure that things can get up and running and back to normalcy as quickly as possible? And what more from the government's end do you think needs to be done or can be done?
Things which we need to do. The current population which we are vaccinating actually forms the majority of people who have unfortunately succumbed to the disease. So if you look at the mortality, 80% of the people are 45 plus comorbidities or 60 years and above. So definitely vaccinating this population saves life. But if you want to break the chain, these are not the people who are venturing out of their house or not having COVID appropriate behavior. They are actually quite adherent to it. It is a younger generation between say 18 to 45 years or 18 to 50 years of age who are actually venturing out of the house, where the COVID appropriate behavior has been at an all-time low. And that's where we need to basically target. We need to target up that population to be vaccinated simultaneously as well, because they are the super spreaders right now. They are actually spreading it, and they are bringing the infection probably back to their homes as well. That's one thing. The second thing which we can do is we can actually ramp up the vaccination program to step out of the hospitals, go to the localities, go to the local colonies, mohallas, set up vaccination camps there, make them makeshift vaccination camps where there are facilities to look after if at all there is an emergency situation which arises because of some reaction, which is very, very unlikely. It has not been really reported that high at all. Then we have some sort of a situation, some sort of availability like a cardiac ambulance or something stationed there. And we can then start a mass vaccination within the doorstep. We have to go like what we do for Indian elections. Every 500 meters, 600 meters, there is a voting booth so that everybody steps out to come out for voting. Similarly, everybody has to be basically coming out to take their vaccine. And that's what we need to do. We need to make it accessible within their reach. Similar steps need to be taken in the rural areas as well, because you need to sort of go up to each Gram Panchayat office, maybe set up a vaccination camp there and start vaccinating people in small villages. It's important that we do the urban and rural population equally at the same pace, so that we actually have a complete herd immunity or ramp it up to a point where it doesn't worsen. Third thing which I'm noticing right now is that if you see the queues in Mumbai, the middle class, the upper middle class, the people living in housing societies and higher rises are actually queuing up for the vaccination. But are we seeing similar queues in Dharavi? Are we seeing similar queues in pockets where the low socioeconomic people are staying? So information, education is very, very important. We have to keep on educating people that vaccine hesitancy or maybe just ignorance about the vaccine, all of these things need to be cleared up. So there has to be a massive 360 degrees approach which we need to actually apply, where infrastructure, availability of vaccine, reach of the vaccine to the doorstep of the people, as well as education about it needs to be handled simultaneously.
As just a coincidence again, as we speak, the number of total vaccinations done that has been released, that number now stands at a promising just below 5 crore. So definitely there is a pickup. I mean, a 3.5 crore number middle of last week has suddenly shot up to 4.84. So that way you have to say that in a country like India, at whatever speed you vaccinate will always be less, but there definitely seems to be a marked improvement, at least in the pace. Ms. Reddy, do you think, based on the evidence and the data which you have, and I'm sure you must be, looking at the data with a threadbare, do we have better understanding of the virus? The optimist in me is believing that the number of deaths and the number of hospital beds which are occupied outside Maharashtra, that number is low. So while the virus number is going higher, at least on the hospitalization and on the mortality front, there is good news. Do you think we have a better grip and better understanding of the virus now?
There is no doubt that a year ago, we were so much in the dark, and over the last year, so much has been learned in terms of prevention, testing, tracing, and especially in terms of treatment. But before I jump into that, I want to just add 2 points for your viewers on the earlier things which were spoken. Number one is that the time gap which has been approved, which is moving from 8 to 12 weeks, is only for Covishield and is not for Covaxin. So these two should not be confused. It's very important to be clear about that. I'm sure the vaccinators are clear, but even those receiving the dose, this is important. And we are doing a lot to make sure that people are cross-checking, they're very clear about it, because we're vaccinating, across many locations at Apollo. So we're being very careful about public information. We've started disseminating to all people who have been vaccinated with us. The second important point in terms of ramping up the numbers, which we were talking about later and doing this faster, I think besides the 2 vaccines that we have available, the government could also consider adding on other vaccines if there is indeed a shortage, because there are various talks about availability that we are not completely sure about. It's counterintuitive, the numbers which are going on currently and holding the age gap at above 60. So if there is indeed a fear of a shortage, number one, enhancing the age gap for Covishield will allow more people to get the first jab, but also significantly, if you can add the Sputnik, the J&J, the one coming out of Cadila, all these were also can follow the same emergency procedure, because if they finish their scientific studies abroad, we can adopt the same and use on an emergency basis if we need more vaccines. That is one point. Now, jumping into the knowledge, the fact is that we have had some of the lowest mortality rates, and I think a lot of credit goes to the Indian clinician and the medical system, both in the government and in the private. And I believe that our knowledge in terms of protocols, especially when people come in early, the mortality rate is below 1%, and even that is in the people with acute comorbidities. So we have a good understanding. We're following the protocols. The critical care beds are available, and therefore I think the Indian medical system has really risen up to the occasion.
pleasure chatting with you to just better understand the overall rise in cases as well as the vaccination drive, how it's proceeding and what more importantly needs to be done. Thank you so much, Sangeeta, as well as Rahul, for taking time out.